Bangladesh, a country that has been coming into the world's spotlight quite often these days for its economic growth, is a country with millions striving to make it a better place to live and to represent. Bangladesh portrays a dream dreamt by the father of the nation, Bangabandhu Sheikh Mujibur Rahman, whose legacy is being taken forward by the visionary and dynamic leadership of his daughter, Honorable Prime Minister Sheikh Hasina. During the COVID-19 pandemic, a national preparedness and response plan was adopted to tackle emergency crisis at the beginning by the Honorable Prime Minister Sheikh Hasina. Bangladesh has achieved the highest cumulative GDP growth globally in the last 10 years and maintained strong macroeconomic stability, resulting in impressive socio-economic development, increased per capita income and reduced poverty. The country has already owned the SDGs. For the second time, Bangladesh is participating in the Voluntary National Reviews VNRs following the participatory approach led by the Apex Committee, SDGs Implementation and Review Committee as the steering committee for the VNRs. There is also a SDG task force in the Prime Minister's office. Moreover, 17 ministries have been given responsibility for reviewing 17 goals. Whole of society approach in implementing and monitoring the SDGs has integrated the views of relevant stakeholders from central to the local levels. We have always involved the people based on equality and justice in the country's development endeavor so that no one is left behind, and to become an inclusive country by engaging peoples from different professions, groups and ethnicities into its development process. Bangladesh has pioneered among 3 countries in localizing SDG endeavors by creating an SDG tracker which serves as a data repository to monitor progress of SDGs along with the national priority 39+1 targets. Enormous efforts are being made to achieve SDGs with innovative programs, good cases, inclusive policies and interventions. Our efforts to implement the 2030 Agenda complement our endeavors to achieve national aspiration of becoming an upper middle income country by 2031 and a developed country by 2041. Bangladesh is confident to become a leading SDGs achiever in the course of its transformational development journey.
Honorable Chairperson, distinguished guests, ladies and gentlemen, I bring you greetings from Bangladesh. I am here today before you to speak on the progress made by the government of Bangladesh in implementing the SDG programs. This is a report on the voluntary national review of this grand global program of which we are a participant. Inform you that the next year, 2021, is a grand year for Bangladesh. This is the year of 50th anniversary of our independence and 100 years of the birth of our great father of the nation, Bangabandhu Sheikh Mujibur Rahman. Ladies and gentlemen, we have consulted about 1,400 stakeholders, of them 28% female and 20% non-government activists. And we had undertaken consultations with 17 ministries on the issue of 17 particular goals. The various initiatives taken by the government of Bangladesh since 2017, I'll now give you a short description of those. We have authored an SDGs action plan, which is elaborate in detail. We have a national data coordination committee at the apex level. We have approved 40 priority indicators for localizing the SDG activities. And also we have launched a very detailed SDG tracker so that activities under SDGs can be measured in various areas of the government. We have formed administrative and action committees at various administrative levels, including the local government level. And we have also set up a framework of collaboration between the government of Bangladesh and various UN organizations who are located in Dhaka and work in Dhaka. We have also undertaking projects to enhance the capacity of the bureaucracy. And significantly, we have included SDGs in the school curriculum. Ladies and gentlemen, some early takeaways from our targets of SDGs are: poverty reduction is on track. We are now in the level of 20%. The present government of Prime Minister Sheikh Hasina started work in 2009. The poverty level 35%. Over the last 10 years, it has come down to 20% now. As a result, hunger has been reduced. No one is going hungry now. Under 5 mortality of young, the newborn, and the mothers also who face postnatal difficulties have been addressed, the figures have been brought down significantly. Most importantly, we take pride in saying that gender parity not only has been reached, there are more girls now in primary and secondary levels across the whole entire educational system. We are looking forward very soon to a day when even at the tertiary level, universities and senior colleges, our women will outnumber men. The growth rate of GDP, as you know, has been significantly improved. We're in the range of 8% per annum, which is a very impressive figure for any country in the erstwhile least developed country group. We have already left the least developed country status, LDC status. We are now recognized as a middle income country by the UN system. We have a huge social safety net program, and we are increasingly spending more and more public funds on that. This year's budget has seen the largest allocation in this area also. The impact of COVID, as you know, is global now. We all suffer from it. Bangladesh is no exception. How we are coping, I would like to mention some activities that we have undertaken. Number of poor has increased because of COVID-19. The people who are in the large informal sector, they have lost their work and they become the new poor, nearly 8 to 10 million. And we have drawn up a huge national program of cash transfer to the poor families directly into their mobile phone accounts from the Prime Minister's office. Health is another sector that has obviously received very high attention now because we were taken by surprise when COVID hit us. Our health system was not fully prepared. Now, in the last 3 months, by increasing more training, by recruiting more doctors and nurses, 2,000 we have taken in, by investing much more than before, we are improving the infrastructure, we are improving the health sector as a whole by providing more free medical support to the rural dispensaries. We have started undertaking online classes for our young scholars. Growth and employment has both suffered, but we are addressing those through our national budget. And we hope if COVID is cleared within the reasonable time, we hope the situation should improve and we'll be able to go back to our old. Ladies and gentlemen, the stimulus package, what we call cash transfer of nearly 12 billion US dollars, which is about 3.7% of our GDP, has been approved by the government under the direct supervision of our Prime Minister Sheikh Hasina for immediate short and mid-term support during up to even 23-24 in some cases for 19 economic sectors, particularly SMEs and micro enterprises and marginal agriculture. We are thinking of introducing a health insurance for all citizens, and we are going to, as I said earlier, going to recruit much more doctors. The hardest level of poverty, about 5 million families given a grant of cash grant and other measures like giving food support to these poor families, and they've been assured of food support for the next 3 months. Ladies and gentlemen, I am at the end of my discussion now. I will thank you for your patience. You know already our Prime Minister Sheikh Hasina has been recognized through various UN prizes, and the Forbes magazine has also listed her. We're happy to note that among the 9 front-ranking world leaders or heads of government, this is a great honor for her and for Bangladesh as a whole. And I thank various UN organizations and various other civil society bodies who have recognized our Prime Minister's good work in this area. So, ladies and gentlemen, I end here with this positive note and thank you all for your patience.
Good evening. First, I would like to thank the officials of the Permanent Mission of India to the UN who have gone through our VNRs and shown keen interest in the development of the health sector of Bangladesh. Bangladesh is one of the countries in the world that has achieved the MDG 4 relating to reducing child mortality as a result of the outstanding performance in improving the child immunization status. Our Honorable Prime Minister Sheikh Hasina received Gavi Alliance Award in 2009 and 2012, and once again in 2019 treated as Vaccine Hero for the outstanding performance in improving child health immunization. She was awarded UN MDG Award 2010 and the South-South Award Digital Health for Digital Development in 2011 to use ICT to accelerate the progress of the health of women and children. Significant progress has been achieved during 2000 to 2020 in reducing under 5 neonatal and infant mortality rate. These rates have persistently declined in this period. However, the path was not smooth. The rapid decline in child mortality has occurred despite widespread poverty, low levels of female literacy, a multi-pronged health care system, and half of the birth taking place at home without skilled assistance. Thus, it is important to understand the factors contributing to the change in child survival. The successful programs for immunization, control of diarrheal diseases, and vaccine A supplementation are considered to be the most significant contributors to the decline in child and infant death. An interesting aspect is that most of the solutions are low-cost, innovative, indigenous solutions, such as the use of zinc in the treatment of childhood diarrhea, oral rehydration solution, delivery kits, tetanus vaccinations for pregnant women, and iodized salt. These interventions have been rolled out locally, scaled up, and reaching to the doorstep of the poor people through the effective mass campaign by both the government and the non-government partners. Community clinic-based primary health care services, the brainchild of our Honorable Prime Minister, plays a vital role to bring his initiatives to the doorstep for rural people. At present, around 14,000 community clinics, each for about 6,000 rural population, are functioning all over the country. Posting of community health care providers with proper skill development training and distribution of adequate medicines have made each community clinic a single service delivery point to deliver preventive screening, promotional referral, or service to the community. These have contributed significantly to the improvement of the overall ANC, PNC, and newborn care in Bangladesh. Treatment is also provided for diarrhea, pneumonia, and other childhood infections through community clinic. Some nutrition-specific activities, social behavior change communication, good hygiene practice are also being provided in hard-to-reach areas through community clinics. On average, 45 patients per day receive service from each community clinic, and almost 95% of them are women and children. For ensuring community engagement, each community clinic has one community group and 3 community support groups having 13 to 17 members, including 1 elected local representative. The community clinic-based service provision has led to increased access of the poor, particularly women and children. It is expected to contribute substantially to achieving SDGs like MDGs with the aspiration that no one is left behind. Thank you for patient hearing.
First of all, I would like to extend my heartiest appreciation to the Moroccan delegation for inquiring about how Bangladesh has achieved gender parity in the primary and secondary levels. For over a decade, and whether it has positively affected women's empowerment in Bangladesh. Bangladesh has made remarkable gains over the past decade by ensuring access to education, especially at the primary and secondary levels for girls. In a country of over 18 million primary school students, Bangladesh has achieved near universal net primary enrollment, with approximately 98% of children of primary school age enrolled in school. Bangladesh has also achieved gender parity in accessing education. Not just the last couple of years, with the strong leadership of our Honorable Prime Minister Sheikh Hasina, Bangladesh has achieved a gender parity index value higher than 1 at both primary and secondary level, meaning girls have excelled more than boys. In 2018, the GPIs, gender parity index in primary and secondary levels were 1.08 and 1.16 respectively. Last year, the GPI value has even surpassed the 2018's figure, as it stands currently at 1.19 at secondary level, meaning against 100 boys, there are 119 girls. The success behind this achievement is not attributed to a single factor, rather an efficient culmination of various efforts taken by the government is the main reason behind this success, such as the third primary education development program. We call it PEDP3, school stipend program, reaching out of school children project, and the school feeding program in poverty-prone areas, as well as the second chance education program and basic literacy program in all 64 districts of the country. The government's plan is to expand and enhance the scope and quality of higher education in the country. The government is very keen to improve the access and quality of education at all levels. Bangladesh has succeeded in raising the education budget in absolute amount every year and is still lurking for a higher share of education in GDP. It would be righteous to say that girls' improved share at the primary and secondary education has increased their share at the tertiary level. The GPI, Gender Parity Index, has almost been doubled from 2005 to 2019 at the tertiary level, which now stands at 0.93, meaning 93 girl students against 100. Improved education has increased women's economic benefit, like women's access to or control over productive assets in resources, services, skills, property, employment, income, information, technology, financial services, etc. Also, the prevalence of child marriage would be lower with increased level of education. In this way, education helps to increase women's participation in every sphere of life, which nonetheless can be termed as women empowerment. Girls have become more vocal in protecting their rights. Education also helps to raise awareness among girls about their rights. In Bangladesh, the proportion of female members of parliament has now been doubled during the last 2 decades. It is highly appreciable that in spite of South Asia's dim performance in women empowerment, Bangladesh is crowned with 50th position in a global ranking by World Economic Forum in 2020, being the only South Asian nation to be ranked consistently among the top 100 countries.